Welcome to This Culture Works project, the Clinical Foundation. A great practice culture is built on a foundation of clinical excellence. It's every dentist and every team's obligation to provide quality care. Now, one of my early mentors and the father of the quality movement, the late Dr. W. Edwards Deming, made some observations about dentistry when he quoted author David Owen, who asked this question: how many dentists do magnificent work? The question is impossible to answer for the simple reason that there has never been a definitive study of quality in dentistry, nor is there likely to be one. Partially because they tend to work alone, dentists resist the idea of being evaluated or even observed by others. And because inferior dental work may not be discovered until years after it is performed, patients are seldom in a position to make informed judgments. End quote. In other words, clinical quality is a personal and a professional responsibility. It's one of the prerequisites of a culture of success. The product you provide must be something you and your entire team can be proud of. It starts with you. While there are many aspects that go into quality care, one aspect is the people you rely on to deliver quality. In addition to the clinical team members that help treat patients, you also depend on suppliers to help you deliver quality. One in specific that you rely on is your primary dental laboratory or labs that produce the restorations that you place. Even if you primarily use CAD/CAM technology and mill the restorations in your office, you still have a lab or two that you depend on to help you with more complex cases. The dental lab is a unique business in that their primary supplier is also their customer. As the dental office, you supply the lab with the most important material, the impression that they have to produce the final restoration. You are both the supplier and the customer. Because of the unique nature of that relationship, it merits some special attention. One of the Crown Council qualified member requirements is clinical feedback. It says this: have a regularly planned meeting with your principal laboratories to discuss ways in which you can mutually improve the overall quality of the restorative work you do together. Submit to the Crown Council the clinical evaluation form summarizing your discussions and the actions taken as a result. Now, here's where the fun starts. Step 1, call your primary lab today and talk to the owner or the manager. Let them know that you want to continue to improve the quality of your clinical work and that you would like to have a call with them to discuss suggestions that they have on how you can improve. Now, be prepared for a long silence. It's likely they have never had a request like that from a dentist. Let them know that they might want to include a technician or two that does your work so that everyone can give their feedback. Once you've scheduled the meeting, send the clinical evaluation discussion form to your lab in advance so they can be prepared for the conversation. The questions on that form include both clinical and communication questions. Great clinical work comes from craftsmanship and communication. It takes both. The questions on the clinical discussion form include the following: what are we doing as a dental team that helps you, the lab, create quality restorations in return? What is the quality of our impressions? What is the clarity of the written instructions that come with those impressions? What could we be doing to make your job of creating quality restorations even easier? What materials should we be considering that we may not be using right now? What changes do you see in restorative dentistry that we should be considering? What else can we be doing to be more successful together? Now, keep in mind that you're also going to be giving them feedback on things that they could do that would make it easier for you. Asking them for feedback first will almost always create what we call the obligation vacuum for them to ask the same questions of you regarding what they can do better. Once you've had that first conversation with your primary lab, complete the qualified member form that summarizes your meeting and keep that with your qualified member documents to be submitted to the Crown Council. Communicate to your lab that you'd like to have a follow-up conversation every 6 months to get updates and progress reports from them on the quality of your work together. It's a process that's never complete. Clinical quality of care is a prerequisite to creating a culture of success. While there are a lot of things you can do to improve clinical excellence, building a better relationship with your lab is a starting point. So, call your lab today to schedule your first meeting. It'll shock them, and it will make a big difference in the work that you do together. Good luck as you complete this Crown Council qualified member requirement.